My name's Bob. I've been a carer for 40 years. My wife, she's got mental health problems and also physical problems, which is double trouble at the end of the day.
My name's Julie Dobb. I've cared for my mum for 33 years with bipolar. I cared for my dad for 17 years with his COPD, with his legs and everything else till he died. I also have 2 other mental health patients that I help through in life with their learning difficulties, with paperwork and booking appointments and taking them to the doctors and hospital. So yeah, I do care a lot for people.
My name's Christine Buckley. I used to care for my aunt before she passed away in 2016.
When you first come into caring, you don't know what to do or what support you want, and as you go on in life it gets more and more difficult. My wife, that was a long time ago now. 5 weeks I tried to get support for her, help for her. At the end of the 5 week she was admitted into hospital. She was in hospital for 6 months. After that she came out of hospital and she was back in then for 3 months. That's 9 months of her life. What I did with the caring while she was in hospital, I had a young child, I was working, and it was very, very difficult. When she comes out of hospital, that's when the fun starts, because you've got to care for that person. It's getting where it's got 24 hours caring. You dress them, you wash them, you get them up in the morning, you put them to bed at night, and it's getting really, really hard work. As you go on through the years, it gets more and more difficult. There was an instance where my wife was admitted into hospital with a GP. When she was in hospital, I was rang up at midnight asking her, could I fetch her home? No way was I fetching her home because she was that ill. The next day I went to hospital, I had a conversation, an argument with a nurse and a sister that she was fit to come home. She didn't even know my name. At the end of that, she was in hospital 9 days with pneumonia, and they wanted to send her back home for me to care for her, which I thought was totally wrong.
Not really. I've not really had any good experiences with it. Doctors occasionally register that you are a carer and take your name down, but then they don't do anything with it or do anything about it. They don't really signpost or register you. They don't make any adjustments in the appointments. They don't even do telephone appointments or understand that you've got really complicated things happening at home.
I didn't get much help with people telling me what to do. I had 4 carers in, at first 2 times a day. With 1 carer, and then it ended up in the end 2 carers 4 times a day. But all the time I went through it, I kept telling everybody, you've got to assess her as though I'm not here because I have rheumatoid arthritis and other problems, and I can't help her other than be, there for her in between.
Right at the very beginning, because you get so swamped the further on you get down the line. I've avoided getting help as much as possible because it's been too much for my family to cope with. Adam can't really tolerate strangers coming in and helping, and it really unsettles the kids. So even things like using the local laundrette, I only started doing that a few months ago, and having them collect our laundry and clean it for us and bring it back. It's not something I would have thought of, but I had to get to breaking point and put me first to be able to do that. So it'd be really good if, right at the beginning, like when he was hospitalised, if somebody would say, these are all the different resources available to you. I'm not going to leave you all this stuff and expect you to read it. I'm going to put all these referrals in for you now. I'm going to, let you know this is the laundrette that can help. I'm going to set that up for you. I'm going to sort out internet shopping and show you how to use it. I'm going to do all these things that would really help without you having to go and fight for them all and find them all out yourself.
And us as carers, I don't think we get recognised at all for what we do. Definitely not. And the information, you've got to dig it out yourself, any information that there is for carers. It's not usually voluntary. I mean, I pick leaflets up now that I sometimes see in doctors, but I've already been found that out now, you know, from a couple of years ago, with different things.
I've had 2 heart attacks, a quadruple bypass, and recently been suffering with depression and anxiety. I mean, the help I've got from my GP was fantastic. She really supported me. She also, she's absolutely fantastic with me. She understands mental health and she understands carer's responsibility. And from the last 6 months, I have had really first-class care. When I was in hospital for 13 days, a nurse, this particular nurse, after a shift, a 13-hour shift, she actually come and talked to me for half an hour after a shift. That's caring.
The main thing is the communication with the carer, and the carer needs support as well as the person that they're looking after. And in my situation, it was the fact that I was ill and it wasn't taken into account that I was ill. You know, and it needs to be for people, because there's a lot of people that are ill and doing it.
They're all entitled to assessments in their own right, not just me having a carer's assessment, but the kind of adult care disability side of it, that sort of assessment that covers things like PAs and personal budgets, and that everybody can access that. Even if you've got to fight for it, it's still an entitlement, because it's now 3 years since Adam's breakdown, and that's never been mentioned up until the past month or so. It would have helped a lot.
I says, why can't she be on national health care when she's on oxygen and she can't even move to the toilet? You know, and the social worker says, well, we can assess her, me and your nurse from the GPs. Well, why didn't somebody tell me that I could do it at home? And then she got assessed and fast-tracked to national health, continuing health care.
The only outlet I get is going to Carer's Stress Busser. It's just brilliant, that group. I don't know what we do without it. We can talk there, people understand because we're in the same predicament. And that's all I feel, the only help there is out there. Definitely.
Include us. We're not included at all. Yeah, they're cared for, yeah, they presumably look after them, but the carer is completely ignored. I mean, an example of this is I've got a social worker, or my wife's got a social worker. That social worker is for my wife, not for me. And I need help, but I'm just disregarded. I don't need, I can survive by myself, therefore my caring role, you know, it doesn't matter about me, or that's the way I feel about it.
Carers are the forgotten ones. I mean, I come out of full-time work, £250 a week, and now, at this present time, it's just gone up in April to £66 something a week. And it's just so annoying where that is, because you've got to live on that money, run a home on that money with a top-up at income support, and that's it. That's all you've got. The government don't care. The council do so much. Like, I do get mum in respite now. She wouldn't go before, but this year she's been in once and I'm hoping she'll go again. Because there's times I get that down, I could just run away. I just feel so isolated and alone. It's just me all the time until the carers come. And then I get a few hours break, so I can bring 3 hours I get. Where can you go? What can you do in 3 hours? When I put her in bed at 9 o'clock at night, where do I go at 9 o'clock at night? There's nowhere, it's just back round home, do my jobs, get off to bed myself. There's just no help.
See me as an individual. I'm normally looked at in how well I'm supporting other people, and they come before me, and I've now got to the point where I'm on the edge of breakdown. I'm getting, well, I've had 90 minutes sleep a night for the past nearly 5 years, and I'm at complete and utter burnout, and I've had to fight so hard to get anybody to listen to me as an individual, and to try and support me because they're focusing so much on Adam and the children.
Now, a lot of part-time in social care, and I understand that part-time, that people who work in that situation, they've got other commitments, so they work part-time. But what I can't understand is when you phone for a support worker, they're either in a meeting, they're being trained, or they're not available, they're off. I mean, this is, if you get somebody working 10, 15, 20 hours a week, sometimes they're in meetings, they're sick, or they're unavailable because they're not there. So, and sometimes they say to you, oh, we'll come back to you. They never come back to you. So you phone the next day, oh, I'm sorry, they're not back for another 3 days. You know, and it really frustrates you, and it really gets to you that you're asking for help and it's not always there.
And I think, another thing I think, like the continual health care, you shouldn't have to fight to get that. It's all in the notes, and it should be all in the care plan. And you shouldn't have to fight, you know, till last few months to get it.
I mean, you're supposed to have a care assessment with the council, the care manager, once a year. I went 5 years without one. And then they were telling me that Mum were going over her allowance with things. Nobody had assessed her to do an increase in the pot. So I was refusing certain calls and what have you because they'd not done it. So that care manager never got coming out and done an assessment to increase things. And you just feel neglected and left all the time.
I've slowly learned over the past year with Adam going into relapse that actually I've got to matter to me as well. I've got to be able to look after myself enough to function, to be able to look after everybody else, and I'm really, really struggling to do that at the minute. And I feel like I'm screaming for help from the rooftops and nobody's listening. I'm only just beginning to get any kind of help at all, and I've had to get to breaking point myself for that to happen. So many people think carers is just a physical thing, don't they? And I've had quite a few uphill battles with services over the past, not understanding not just that I'm caring for someone with mental health needs and that's, you know, that's valid. You're allowed to be a carer for somebody with those kind of issues, but actually you can be a carer of my age, you can be a carer with a family, you can have young children, you can be a parent carer. It's still an uphill battle trying to get people to understand.
You say, do we get any help? Do we get any financial help? No, we don't. Oh, I apologise for that one. I get £100 respite for a year. Does that really help me? No, it doesn't, I'm afraid. I'm not saying financial help, but just supporters. As I say, a carer is not just for Christmas, it's for life. Thank you.